So I want to welcome everybody to our Safe Disposal of Medication and the Prevention of Diversion webinar put on by Mountain Pacific this afternoon. Our hosts today are going to be Kyla Newland and Jesse Kenzie. Kyla graduated from the University of Wyoming School of Pharmacy in 2007. Kyla works on several patient safety initiatives across Alaska, including reducing adverse drug events, opioid safety, chronic disease management, and immunization promotion. In 2022, Kyla received the prestigious Bowl of Hygeia Pharmacy Award given by the American Pharmacists Association, recognizing pharmacists who possess outstanding records of civic leadership in their communities and encouraging pharmacists to take active roles in their community. Jessie is a registered nurse who serves as a nursing home account manager in Montana. Jessie has over 12 years of experience in long-term care pharmacy services, infusion therapy instruction, compliance, education, quality assurance, minimal data set or MDS coordination, and correlation medicine. Jessie is an advocate for quality, safety, and support for older adults and believes in a community-based approach to healthcare. Sorry, I guess I should have advanced the slides before. All right, so we'll go ahead and let you ladies take it over from here.
Thank you, Miranda, for the warm introduction, and thank you everybody for joining us today to discuss this timely topic as we're seeing the drug take back event that happens biannually this Saturday. It's a timely topic. And then as we look at things that are going on with the opioid epidemic and drug diversion, we wanted to spread some information about what's going on in each of our states and our region for safe medication disposal and best practices. So thank you for joining us. We can go to the next slide. So just a few statistics to start us out here. The CDC estimates 142 million prescriptions were dispensed in the US in 2020. And if we look at the percentage of opioids that go unused as far as these prescriptions, it's estimated that up to 70% of post-surgical meds are left over and unused, leaving an area for potential abuse or diversion. And so it's really important for us to make sure that these medications are disposed of safely. And we've seen this increase in overdose deaths, as everyone is probably aware, and 74.8% of these did involve opioids. The latest statistic in the state of Alaska that was pretty alarming that we saw was that we have actually seen a 71% increase in overdose deaths, and that's based on preliminary 2021 data. So just one state-specific statistic, and I think we're seeing this trend nationwide, so something really timely that we need to tune into. Next slide, please. So this is a chart that many of you probably have already seen, but this is the latest drug-involved overdose deaths related to opioids. So we're just seeing that curve go up pretty starkly here in the last few years. And we can look at the next slide and the overdose numbers, which I stated earlier. We've seen that go way up in the last couple of years. So the latest statistic was 68,630 overdose deaths. Next slide, please. So as a way to mitigate these opioid issues, there are several ways that we can dispose of our medication safely. So as everyone knows, communities have drug take-back events. Those happen twice a year. And I will have Miranda put in the chat the location of the current locations in each of our states, if you could, Miranda. And then there's also these year-round drop boxes and collection site locations, which are popping up kind of everywhere, a lot more commonly in the last few years. A lot of pharmacies will have these, and some other kind of community-based sites are even starting to have some of these drug disposal bins where patients can really just bring in medication anytime, and they don't have to go to these special events that are only twice a year. And then I'm going to talk about some state-specific programs and donation programs that are really kind of innovative. We're lucky to have in our region, Wyoming has a pretty robust system for drug donation and redispensing in certain cases for certain medications. So that's really cool. And I'm going to outline that program. And then our last option is using drug disposal systems like the doTERRA system that some of you might be familiar with. And those are systems that patients can use at home and dispose of their medication. So Miranda put in the chat both the link to the DEA take-back sites, and then there's also a link for the year-round Dropbox location. As we were kind of exploring this a little bit, Jessie actually found this out. She was looking in her community to see if there was a Dropbox, and so she did a search on the DEA website, and it did not show up that there was a location in her area. So we're seeing that there's actually some gaps, because when she dove in a little bit further, she found out that the police department in her community was actually accepting medications, but it wasn't listed on the website. So that's something to be aware of, and something that could be a gap in locating disposal locations. So sometimes you have to look a little bit deeper into what's going on in your community. So just to be aware of that. We were seeing a little bit of inconsistencies in locations that were available and locations that were actually posted on the DEA website. And then for the take back events, new locations can pop up there kind of anytime before the event. So it's always good to check back in and make sure you have the most current information. We can go to the next slide, please. So this is a map that shows kind of the drug repository programs that are available in each of our states and our region. So as of fall 2021, 40 states, Guam and Washington, D.C. passed legislation to establish prescription drug repository programs. But only 27 of these states have an operational program. And then 13 states plus Guam have laws enacted, but no operational program. So it's kind of, everybody's kind of at a very level of implementing these programs. And as you can see, Wyoming being in the orange here, they have enacted law and they have a very operational program, which I'm going to talk about. So operational programs are those with participating pharmacies, charitable clinics, or hospitals approved by the state to collect and redistribute donated drugs. And there are actually 12 states, one of them being Montana, where they have more permissive programs related to cancer medications, in addition to just the regular drug repository programs. So if we can go to the next slide, I'm going to start talking about the Wyoming Medication Donation Program. Were there any questions at all, Miranda, yet?
Unfortunately, I can't monitor the chat and share the slides at the same time, so I'm hoping that Mary or Minette are watching for us.
Okay.
Yeah, no,
Wonderful.
there's no questions in chat yet.
Okay, thank you so much. Feel free to put your questions in chat as they come along and interrupt me if you need. So the Wyoming Medication Donation Program is really cool. It reduces medication waste and improves medication access for low-income Wyoming residents who lack adequate prescription drug insurance coverage. They have a central location and they act as a mail order pharmacy where they use donated medications to fill prescriptions for eligible patients at no cost. And they also process incoming donations and perform safe medication disposal to reduce drug diversion while positively impacting the environment. And one other thing that I noted that I thought was really cool is they do accept medication from all 50 states. And you'll see here, they can accept the medications. They will either dispose of them in a proper method or they can recycle them. And these are the rules on which items can be redispensed and which items cannot be redispensed but will be disposed of properly. The other thing Wyoming has that's really cool is if you want to locate a donation site, you can text your county name to 307-370-2086, and you will actually get a message back that gives you the location of a drop box or donation site nearest you, which I thought was really cool and unique. So we can go to the next slide. If you go to the next slide, if you go to the website, you can see the map of all these donation sites that are located across the state of Wyoming. So at the current time, Wyoming does not, that I know of, have a medication disposal bag, kind of like state run or statewide program to distribute medication bags, medication disposal bags. But Jessie is going to talk about something that is going on in the month of October as far as getting free medication bags. And I'll let her talk about that during her portion. So let's move on to Alaska. So Alaska does have a program for obtaining medication disposal bags, and it's through funding that the state has. And so they will actually, these are the sites on the map that you can actually go and pick up bags, but you can also go, and Miranda will put in the chat, to the state website and order medication bags for your facility that you can hand out to patients, or patients can go there and also get access to these bags, and they are free and they will ship them to you. Next slide, please. Just a friendly reminder, if everyone can mute their lines, we're getting a little bit of background noise. So Montana has a specific site where, or a kind of a directory, I guess I'd call it, of their Dropbox locations. And as you can see, they're extensively available throughout the state. As far as having just universal access to disposal bags outside of folks or facilities that might purchase those and either sell those or give those out to their patients, there's no universal distribution of medication disposal bags currently that we know of, unless somebody else has additional information. And we can move on to Hawaii. So Hawaii does not have really a universal directory outside of the DEA directory for medication disposal or any universal distribution of medication disposal bags yet. But they do have a nice flyer that they do for the Take Back event that has all of their locations. And additionally, we'll put the link in there where you can look at all of their medication waste options that are available in the state of Hawaii beyond the Take Back events. So I think that wraps up my portion. Is there any questions so far or comments?
No, nothing in chat so
I
far.
see Jessica Dahlman raised her hand.
Yeah, could you talk about that? What was it, the doTERRA medication disposal bags? Because in our county, there was one drop-off location that had those available to give out, but nobody was taking them. I think that was on like one of the first slides.
Yeah,
is that what you're talking about when you're
yes.
talking about the medication bags?
Yes, and actually that's the next portion of our presentation. Jesse's going to kind of go through those bags, what's available, and some of the technologies. And what state are you located in?
Montana.
Okay, so there was a site that was like just giving those out for
yeah,
free.
It was a Columbia Falls Police Department.
Oh, okay. Yeah, so I'm thinking that you know, individual entities can purchase those and distribute them. And I don't know to what extent that's happening in all the communities, but there's no like universal state kind of dispersal process in Montana that we know of. So I will let Jessie talk about kind of the availability of those products. Does that answer your question?
Yeah,
okay.
Awesome.
Awesome. Okay. All right. Well, Jessie, I'll let you take it from here.
Yeah, thanks, Kyla. And there was a question in the chat, a really good question that came direct regarding disposal of inhalers. Inhalers are a tough one because most often they are considered a hazardous waste product. So really the best thing, the best advice I can give everyone for inhalers is the first thing you want to do is look at the disposal instructions on the manufacturer package insert. Now, if for some reason you can't find the insert, or it's long gone by the time you're ready to dispose of the product, you can reach out to local pharmacies and see if they're accepting um, uh, hazardous waste for disposal, such as you have a bag full of inhalers, and they may be able to guide that. They can be tricky, and sometimes there's some mixed messaging as far as the proper way to dispose of them and what the guidance is versus what the reality is. So my best advice is take a peek at that individual inhaler's manufacturer recommendations for proper disposal, and then kind of go from there and then recruit some help from your pharmacist. So I hope that answered that question. And then I see there's another question too from April. Are there drug disposal bags for individuals? Great question, and the answer is yes. And I'll talk about some of those resources that are available for individuals at the community level, as well as resources that kind of cross over to long-term care or healthcare provider settings. And the beauty behind some of these products, April, that we'll talk about, they don't have to go necessarily through the Stericycle process or a approved vendor to pick up the waste. These have been approved on multiple levels to go into the normal trash, just because of how the product works. And then let's see, Kyla, I'll let you look at the second half of that question too. And yes, Wyoming, Wyoming is setting a great model as far as implementing a medication donation program. And I was so glad that we could share that program forward, because in preparing for this presentation, we really realized there's gaps and inconsistencies as far as what disposal recommendations are in certain areas, as well as what take back resources are available. So yeah, we are always looking for better options too, and how we can kind of standardize and really look at waste reduction and how that impacts us all on multiple levels. So good questions, you guys.
Yeah, Jesse, I'm not aware of any other disposal method versus Stericycle for those P&D listed meds. If anybody else has information on that, I'm not aware of any at this time.
Thanks. I know those inhalers are tough.
Mm-hmm.
Super tough. Good questions, you guys. Feel free to drop your questions in chat. We want to make sure we snag those, and this presentation is informative as we can make it. So with that, it goes in nicely with this next objective, disposal recommendations. When we look at key factors in disposal methods, we want to make sure that we're disposing of a medication in such a manner that it's non-retrievable. So essentially, when we talk about medications such as controlled medications, that is such an important concept, that we're disposing of medications that are permanently I guess you could say structured or unable to be retrieved. Flushing and putting medication waste down the drain is now illegal for DEA registrants. So what does that mean? What does that translate to? So there's actually in writing now that if you're a provider's office, a pharmacy, you have an association as far as a DEA number, it is illegal, and you could face a fine for flushing down medications. So when you look at some of your processes for med destruction, perhaps in the community as well as a healthcare setting, kind of ask yourself, can that medication, in simpler terms, can that medication be picked out of what I'm putting it in? So maybe if you're still doing a kitty litter substance or a coffee ground substance, and you put all your medications into that kind of mixture, and then once maybe your container is full, you add more water and swirl it and let it sit. Kind of ask yourself, Is that undesirable? Could someone that really wanted to get in there and perhaps get some pills out, could they still retrieve those pills and still receive an effect from it? So, you know, just an opportunity to review those systems and take a look at your current processes. And really those systems need to be compliant with both Environmental Protection Agency, the EPA, and DEA drug disposal regulations. This has been tough because when you look at EPA recommendations, DEA recommendations, White House rules, all of those recommendations don't necessarily always align. So that's where you can recruit the assistance from your pharmacy or pharmacist and see if they can help you with your systems. And I'll just say, you know, as we look at, you know, some of these disposal recommendations, the why behind it, you know, we continue to see how our water sources have been affected, and various studies that demonstrate that flushing, you know, that those medications are showing up in places that aren't intended. Next slide, please. All right. So what are those systems? What are some recommended systems that we could utilize? This first one I want to talk about, this is a doTERRA drug deactivation system. This can be purchased for in-home use in the community or in a healthcare setting, perhaps even a long-term care setting. So when we look at the doTERRA system, the one I have up on the screen here, this is just one product that this company provides. It's kind of a, I guess you could say, a jug that's the size of about a bleach bottle. And what's really nice about this system is, depending upon the size that you purchase, you can fit anywhere from 1,000 pills to 2,500 pills within this container. You can also dispose of patches, and that will meet compliance standards within this system. And all you have to do is add water initially to the jug, add your pills or creams or patches, and then once it fills to the line indicated on the jug, you just invert this, and it kind of activates that chemical in there, and it can go in the normal trash. You do not have to dispose this in a regulated manner. It's approved to go in the normal trash. So it doesn't have to go towards your biohazard weight, which is nice. Now, this jug, again, depends on the size that you want. They come in cases. And one jug average cost, this is what most people want to know, right? How much will this cost me? It's $63. And it's really, I mean, a drop in the hat as far as compliance. And it looks like a few folks are using this. That's great to hear. It is like a black charcoal chemical in there. It's super easy to use. Now, this same company, again, you can get different systems. So you could get a pouch, and we'll talk about some of the programs that are running this month. But you could get smaller containers that may fit perhaps in your medication cart, or larger jugs that could go in the corner of your pharmacy, med room, or your secure area. The other nice thing is they have mounts, so you could put this jug in a wall mount and secure it to the wall. But again, it's nice. It deactivates the medications, makes it non-retrievable, and meets those safe environment standards. And a lot of these too, their intent behind adding charcoal into the product is, even if someone did try to consume it because they knew perhaps that there was narcotics that were just put in it, it would force them to vomit. So they wouldn't get anything out of it. And I see some other folks in chat, RX Destroyer, yep. Yeah, and we will talk about that product too. I appreciate that one, and that's one of my favorites. Next slide, please. So this next system, I know that there's some folks looking at this to implement it in their settings. This would be more for a healthcare setting. This is called the Cactus Sink, and it's a controlled substance waste management system. This one, much of the same concept, makes the medication non-retrievable. It's kind of interesting, the design, because there is a separate disposal component on the top of this device based on the med you're trying to get rid of. So if you're getting rid of pills, there's a little slot that says pills here. And why I point that out is because within that drop for the pill, there's a maze. So even if you wanted to retrieve that medication, you wouldn't be able to because of how the maze is that drops into the bottom to the container. This container comes with a lock and key, so you could potentially control who has access to the medication. And the disposal cartridges within this unit also render the medication, changes the chemical makeup of it. And good question, you could put OTCs down here too. You do have to be aware that some of these disposal systems, there is disclaimers about hazardous materials and what is not eligible to be disposed of. So you would have to read the individual manufacturer recommendations for exclusions. But on this smart container, this Cactus smart container, they do make different cartridge inserts into this box that would be for liquids, so IVs. Maybe you had some folks on pain pumps and you needed to get rid of what was in that cartridge. This would be a manner in which you could dispose of it without going down the toilet or the sink into the water system. I will say, so here's again what everyone wants to know. This unit requires batteries or to be plugged in. It does come with a wall mount. It has alarms and alerts when the lid is open or when it's been accessed. Couple things though, you still would need to contract with a waste management company to dispose of these containers once they're full. The outside portion of these systems, it's about $150. The cartridges required are anywhere from $20 to $30. So once those cartridges are full, you don't reuse those. Those containers then would go in your waste management system. So when you compare to doTERRA and RX Destroyer, this is a little bit more hardy, but it does give you that option for liquids. And then I see there is some good questions about liquids. So liquids are hard to dispose of. And Jessica said none of our local locations will take more than a small amount of liquid medications. Thanks, Jess. And we can research recommendations too when you're looking at larger volumes of medications. I know that when you look at IV therapy, one alternative, if it's not an IV bag that has a medication in it, so say it's just a hydration, a normal saline product, I know that in some rural areas, in various regions, vet clinics will take those as donation because they use them for spay and neuter clinics. But as far as larger volumes that are medicated or have medication in them, we'd have to research those options. That's a really good question. I'm glad you asked it. All right, next slide, please. And yeah, Cactus is still in business, you bet. All right, so this next disposal system, it's kind of, this has been around for a little bit, and this kind of evolved from Drug Buster and turned into RX Destroyer. This product, again, is inexpensive. It's easily accessible. You can buy it from your supply manufacturer. For community members, you can get it on Amazon, or your supply distributor, I meant. Or you can get this on Amazon. You can buy it in single little bottles, or you could buy it in bulk jugs. This company also provides patient education for using it, or excuse me, product education for using it. And what's nice about this, similar to doTERRA, is you add the medications in it. Once it's full, that chemistry in it kind of denatures everything, and it can go in your normal trash. It does not have to be in your biohazard per weight, and add up to your charge with your monthly biohazard. So this can go in normal trash. It's been approved. And the sizes, these come with wall mounts as well, or you can get a smaller jug or these little bottles. They're about the size of a pop bottle, and you could sit them in the bottom of a medication cart or mount them appropriately to the side of a medication cart. And they also come with this liquid hardener that you could use for greater volume liquids. So that kind of helps a little bit too when you're looking at, I think it was Jessica that answered about large volume fluids. This liquid hardener actually may be the answer there too. So it's just hard when you have IV bags, how to sort that out and use that product. Now these, again, you can use for controlled or non-controlled substances, as well as transdermal patches, pills, capsules, and these are ready to use. You don't have to add water into these RX destroyer containers. There's no batteries to change, anything additional that you would have to do. So these are super nice. And as far as cost on these, the little bottles run around $10. Those would be the pop bottle size. And then the larger jugs, about the 64 ounce, those average just under $30. So a pretty good investment when you look at safe disposal of medication and diversion prevention. Yeah. Any questions, you guys?
I have a question.
You bet.
So, like this RX destroyer, you put the medication in there and then you throw the entire bottle into the landfill.
So this is EPA and EPA and DEA approved to go into the normal trash, yes. Because of how the chemistry is in here, it denatures the medications. But yes, it's technically approved to go into normal trash. Good question. And I'd be happy to send you, if you need the link, or Kyla might have put that in the chat too.
Okay.
Sorry, did you have another question too?
Well, I was thinking, it's just another plastic container that's going into the landfill. Is that something that can be dumped out and into the, landfill itself, and then the plastic containers recycled? I mean, I know I'm getting off on a tangent here, but we're taking care of waste to create more waste.
Right. That's a good question. And I wouldn't be opposed to emailing the manufacturer, and I'll ask that question, and I'd gladly share that back with the audience to see if that's an option, or maybe that's something they're researching or working to develop. It wouldn't surprise me at all, actually. So yeah, I'll ask them. Yeah. And then there's another question in there. If you mount to the side of a med cart, how do you keep it secure from patient safety? Is there a lock on the mounts? Okay, so depending on the product, I did see some that have a lock. Some of them are just child safe turn taps on the top, like you would a prescription bottle. But the alternative that I would consider is perhaps putting that mount on the inside of the med drawer. And then that would prevent the product from, if someone didn't put the lid on tight enough from tipping over in your drawer. So maybe that's an alternative. But I feel like it was either doTERRA or this one, they did have a little locking mechanism. And again, we'll make sure those links are shared forward for you guys. Good questions, you guys. Any other questions on those products?
Hi, this is Carly in Anchorage.
Carly?
Hi, and I'm glad you're doing this. This is awesome. I'm so sorry I can't remember the details, but this several years ago we had a home health nurse helping a patient use one of the doTERRA pouches,
Mm-hmm.
and it exploded. And I remember having to look into, what kind of training needs to be done. And she said she filled it the way it was supposed to, but I'm so sorry, I can't remember the details, but she got, sprayed in the face when it exploded.
Yeah, good question. So depending upon the product type, you definitely, and your setting, that's where you want to make sure that, we're aligning that product type with our appropriate setting for multiple reasons. Along that side, that line, those pouches, you don't activate until you are full. You've filled them with the content you want. And then once they're activated, you would throw them away. The thing is the manufacturer recommendations, you want to make sure you're not putting like Alka-Seltzer products in there or effervescent items. And then there's a list of other medications that may have a chemical reaction when they're in there. Effervescence is the big one that you would want to make sure. And then when you seal it, you're sealing it away from your face. And there is some specific practices based on that product. So along that line, on these jugs, it says on there not to fill past a certain point because they will bubble up in there. And I'm glad you brought this up because when they first launched these RX Destroyer products, they didn't recognize that they could create an air out of there, and they didn't have vents on their lids. So they actually had to go back and create a vented lid and send that out to everyone that had purchased the product because they recognized that accumulation in there was creating an issue. So again, there is educational opportunities with each product. You want to make sure that that product aligns with your environment. And I'll say too that this product here that we're looking at on the screen would be more in a line for a long-term care setting where the pouch type, where you don't activate it till it's full, I would deter anyone using that in a nursing home setting because that essentially becomes a portable purse of medications, right? For, there might be an increased likelihood of diversion. So I'm glad you brought that up though. Yeah, these new caps are vented for that reason.
Is there a doTERRA rep that would do a little training maybe for our in-home caregivers?
Absolutely. And if you drop your name in the chat or send me a message, I can connect you with the resources I have. You bet. And that goes with anybody listening online today. Yeah, thank you. Any other questions about these disposal systems? All right, next slide, please. So, as we kind of progress through our presentation today, we thought we'd just take an opportunity to summarize that October is Prevention Month, and there's a lot going on in our communities. We have a Red Ribbon Week this week. Those of us that have kiddos in school, I'm sure, are going through the daily themes and seeing what clothing they have to wear or dress up as. National Take Back Day, as we've started our presentation, it's this weekend, 10 a.m. to 2 p.m. National Drug Take Back Day. And I just want to take a moment on National Drug Take Back Day. This program, it's you don't have to pay anything. It's free. You don't have to give your name. If you're cleaning out your mom and dad's closet or cupboard and they've hoarded medications for the last 10 years and you're taking it in for them, there is no punishment. There's no disclaimer of you're accepting your responsibility for dropping those meds. This program is designed to drop medications off, you know, without having to sign anything or take any, you know, accountability to what you're dropping off. So we encourage the use of this program. Okay. Gone for Good. So this is a program that we discovered for the month of October. doTERRA is offering free drug disposal pouches. You just have to get online and fill out the email link and they will mail it to you for the month of October. Here's the caveat, and I know our friends in Alaska and Hawaii aren't going to smile at me about this, but we just found out that the free program this month, Hawaii and Alaska are excluded, likely because of shipping. And I will tell everyone online, you bet I emailed the manufacturer an impending reply to see what other options they have.
Oh, thank you for that.
Yeah.
Go get them, you know.
Hey, everyone needs help. Everyone needs help. And really, this is a great program. So how can we share it with all those that would benefit? This is, I don't know, Jessica, if this is every October. I just stumbled across it and thought this is awesome to share forward. But you bet I'm going to keep an eye out for it next year too. So if you're in Montana and Wyoming, folks, feel free to get on and sign up for that. This is a nice community resource. And these for our long-term care friends, you know, this is an option to incorporate maybe into discharge planning or incorporate this conversation into family members that bring up the grocery bags of old meds, that maybe there's some other options to dispose of these medications safely. And then also, you know, just sharing resources. Remove the Risk is a campaign that that the government puts on around educating on the serious dangers of keeping up with unused medications in the home as well as community. And I share this because there is a ton of resources within this Remove the Risk campaign. There's toolkits, there's videos for public service announcements, there's social media posts, there's radio recordings, and there's fast facts. So, you know, again, the FDA shares this forward with us, and there's a lot of info there and offerings. Next slide, please. So as we kind of transition from community to long-term care, we have the opportunity to discuss the connection between safe disposal and diversion in long-term care. So when we look at really the facts and the statistics, long-term care facilities dispose of over 740 million tons of unused, controlled, and non-controlled medications annually. I was kind of shocked by this number. I don't know, you know, how many folks in listening audience are, but I certainly was. 10% of nurses are thought to be part of that category that have addiction or medication abuse struggles. 10% of health professionals in general are struggling with addiction. And then you add all that into the opioid epidemic. It's definitely something to consider and doesn't go unnoticed. Next slide, please. So again, as we continue just to make that connection, the National Center for Drug Abuse Statistics has found that around 59 million people have reported misusing prescription medications. 50% of those people are over the age of 12 and have illicitly used drugs at some point in their lifetime. Nearly 92,000 drug overdose deaths occurred in 2020, and I'm sure this is higher, just like Kyla had pointed out. And this includes deaths from opioids, such as prescription painkillers. So when we look at safe disposal practices and options for our setting and connecting that between long-term care and the community, we can see where it's definitely important. Next slide, please.
Jesse, I see that
Yeah.
Jessica has her hand up.
Yeah.
Go ahead, Jessica.
Okay, 2 slides back, it was 740 tons. Yes, amazing, crazy number. And that's just a long-term care facility, you said. Do you have any idea what like the total, including everything would be, including long-term care? I mean, that's mind-boggling.
It is. And I don't know how we could track that down, but interesting when we look at this from long-term care and then you look at the DEA take back programs, they sum up the pounds collected every take back, and you add that would be, maybe a sliver of the community total, and you add that into the long-term care total. Boy, that puts a different spin on things, doesn't it?
It sure does. I mean, I am getting the numbers for the amount that's disposed in our landfill here, and I just can't imagine all the other landfills and wherever else that they get disposed of. The tonnage on that number is wow. That's just crazy.
Mm-hmm. It is, and we don't talk about it, do we? Especially as nurses, I don't think. So as we continue on and we look at the chain of custody and the importance that plays when we look at really drug diversion, prevention, and safe disposal of medications, it's important to at least touch upon receipt and control of medications when we look specifically, again, in healthcare facilities, long-term care settings. So what does that mean? What I want to touch upon is just a few highlights here. When we break down the chain of custody and we look at delivery, we look at your logbooks, you look at your inventory record within your logbook, how you're storing your medication and reconciliation and disposal. You want to make sure that you're auditing these processes and you don't have any gaps. Okay, that's great. What does a gap look like? Well, when you look at your logbook and you notice that maybe not everyone is signing off at shift change, that's a gap. Everyone should be signing off at shift change. Maybe they're not always putting a date when they sign together at shift change, 2 signatures, or a time. Well, why is the time important? If you have a break in chain of custody and you're going back doing an investigation, a time on your logbook to show when those 2 nurses counted and did medication reconciliation is going to be a critical component to your investigation. So that would be an example of something to audit. Your logbook in general, do you have pages folded over, stapled, paper clipped? Are they loose? Yes, maybe I do. Why is that important? Many investigations I've been involved in, when we went to the root cause of how the diversion was able to kind of go unnoticed for so long, it was noticed that when the nurses did medication med count, the reconciliation at shift change, they had just bundled pages together and closed those out saying, oh, we're done with those. Or that person's no longer, they're no longer on that med. So we paperclip these together. Well, a person that is going to divert medication may divert from those pages that were within that paperclip, and no one's going to catch it necessarily. So again, having an intact, complete, well-documented, well-labeled logbook inventory record is important. Storage is important. If you get medication deliveries by a courier, you want to make sure these aren't sitting on the floor by the front desk or in an open area. They're in a secured room, and that delivery manifest is reconciled when that tote is accessed. And then ultimately disposal, like we talked about. That's an important component to the chain of custody. You don't want to save up medications. You want to evaluate processes to dispose of medications as soon as possible. And you may say, hey, I'm the only nurse on the cart. How do I have a witness to dispose of something as soon as possible? You can secure it in your narcotic drawer perhaps, and at shift change, you would have a co-signature to have a witness. Next slide, please. So medication management and long-term care, and again, just a couple tips. When you look at controlled medication orders, you really want to avoid those PRN orders, those as needed orders that say 1 to 2. Again, as we look back at diversion investigations, this is usually an element that was in that investigation where there was an option to give 1 to 2 tablets to a patient or a resident. And unfortunately, 1 tablet was administered and 1 was diverted. So that helps tighten that process a little bit. And then, again, just a couple elements to look at. Frequent use of emergency kits. If you have the same individual that's using an emergency kit more frequently than others, and it's often for the same types of medications or maybe same class of medications, that is worth looking at closer. The emergency kits are often developed and implemented for emergency use, not routine use. So that's usually an indication that there's something else going on. And again, documentation, reminders. You want to make sure that that count is occurring for your narcotics every time key exchange occurs. So if someone's covering for you for an hour, perhaps, and you'll be right back, you still should be doing that count and reconciliation of your narcotics. Okay. Next slide, please. Discontinued medications. This is really where the break in chain of custody is the most likely to happen. So as we shared, we have opportunities to look at our medication disposal processes, our policies. We do not want to stockpile medications. We want to try to discontinue those, waste those as soon as we're able to, and review those processes to be consistent, and review those policies where we really want to avoid policies that say the director of nursing should always be the one that destroys medications. If you can eliminate using that singular person, that helps to prevent diversion. And recruit the assistance of your pharmacy. They're definitely there to help. Next slide, please. So discontinued medications, I like to remind everyone, the Sharps container is definitely not an approved disposal option. And that's where we often find ourselves in a little bit of trouble. And that's often where we see diversion occurring too, is out of these systems. And there's also an opportunity when we look at, it's easy to say don't stockpile meds. And when you walk in a medication room in a long-term care setting, a lot of those medications may be meds from home. The family brought them in, right? So this is where we have an opportunity to perhaps share forward some of these other systems we discussed today, such as the doTERRA, maybe at-home pouch, or RX Destroyer has some at-home delivery systems for safe disposal. We could share those systems with family members versus taking those medications from those family members and them adding to the stockpile that we now have in our facilities. Next slide, please. And again, proper disposal, why is that important? Because of the sheer volume, the potential impact to our environment, and there is associated fines. And I will share forward that There was a study almost 20 years ago that showed our streams, about 80% of our streams and waterways were impacted by pharmaceutical compounds or waste. Now, in the UK, there was a new study this year that studied across water samples from 258 rivers in 104 countries. And they were only able to find 2 rivers within that entire study that were not contaminated with pharmaceutical pollution. And they really reduced from that is those villages were so isolated, they didn't have access to modern medicine. So pretty interesting, pretty interesting. Next slide, please. And again, why is proper disposal important? A long-term care setting, we do have some guidance. That FTAG 755 that charges facilities with establishing a secure method for disposal. And then the reality diversion. Long-term care can potentially be a source for medication diversion into the community if medications are not disposed of properly. Next slide, please. So as we conclude and look at that connection, I think the different products, depending upon the placement, the access, the awareness, and the direct relationship to your risks and your setting, there is a potential for improvement to review our documentation, our processes, and perhaps our methods, and ultimately partner with your pharmacy. Next slide, please. So in summary, improper disposal of unused medications, it can not only add to the burden of our epidemic, but also to diversion. And it can be harmful to the environment and public health. And there are multiple disposal options out there. If you had put your name in the chat or messaged us, I know we are more than happy to reach back out with you with those requested resources. And these resources are important considerations for both our community and our facility settings. Next slide, please. Here's some resources. We will send these slides out to all of the participants, and this presentation will also be recorded and shared to our Mountain Pacific Quality Health webpage. And as always, if anyone has any questions or follow-up needs, definitely reach out. We're happy to help answer your questions and track those resources down.
Hey, Jesse, I just had one thing to add based on a question we had earlier.
Yeah.
So I was able to find that the doTERRA system is certified as an I'm green plastic for disposal. But I'm not sure about the RX Destroyer products because I wasn't able to find that. But we can definitely find out if they have a similar kind of environmentally friendly plastic in their product.
Yeah.
That's great.
Oh, good, Jessica, you're still on. Okay, good. All right. Well, Kyla.
Thank you, everybody, for your attention today. And
Yes.
please reach out if there's additional things that you need further information from us or assistance.
Yeah, thank you, everyone. Or if you would like to hear further presentations on options and safe disposal and diversion prevention, please reach out. Take care, everyone.